Hey there, I'm Dr. Jocelyn Carter, and today we're going to tackle a question most men don't say out loud, not at the gym, not at work, not even with their closest friend, but one that quietly sits in the back of your mind. Am I normal? Yes, I'm talking about penis size. And if you've ever felt insecure, compared yourself, or wondered what normal really means, you are not alone. Before we jump in, take a second to like this video, subscribe, and comment below. Where are you watching from? I want to hear from you because this conversation is for men just like you, men who want clarity, confidence, and peace of mind. Today, we're going to separate myth from science, fantasy from biology, and insecurity from truth. And I'll show you exactly how to measure length and girth the right way so you know where you really stand. Here's the first thing to understand. Penis size is mostly normal, and most concerns are rooted in perception, not biology. A landmark global study of over 15,000 men published in the British Journal of Urology International found that more than 90% of men fall within a completely normal range. So why do so many men feel inadequate? It usually starts early. Imagine being 13 or 14 and stumbling across your first adult video. You have no context that what you're seeing is performance, not biology. Those men weren't chosen at random. They were selected for size, angles, lighting, and sometimes digital enhancement. That becomes your subconscious reference point. Add locker room talk, bravado, and crude comparisons, and suddenly a completely average body feels not enough. Studies show up to 60% of men report dissatisfaction with their size, even though over 95% fall within the medically normal range. And here's a key reality check. When women are surveyed, only 5 to 10% say penis size is very important in a partner. It's not about extremes, it's about comfort, connection, and confidence. So if perception doesn't match reality, how can you know your true size? That's where correct measurement comes in. I'm Dr. Jocelyn Carter, a board-certified urologist with 5 years of experience helping men understand their bodies, optimize sexual health, and regain confidence. Over the years, I've seen thousands of men who thought they were below average realize that they were actually well within the normal range all along. Today, I'm going to give you the facts, not the myths, and teach you how to measure accurately so you can finally put the insecurity behind you. Mistake number 1, measuring incorrectly. Most men actually measure themselves wrong. Think of it like stepping on a broken scale. No matter how many times you check, the number is off. Common errors: pressing the tape too far forward, starting at the skin instead of the pubic bone, measuring from underneath or stretching incorrectly, measuring flaccid instead of fully erect or stretched, comparing when cold, anxious, or barely aroused. Biological explanation: the penis is highly responsive to blood flow, temperature, and nerve stimulation. A cold room, stress, or anxiety can shrink it significantly, making a comparison to an adult film completely unrealistic. Practical fix: use the flaccid stretched method, which is standard in research and accurately predicts erect length. Here's how. Stand upright and use a ruler or soft tape. Place it on top of the penis at the pubic bone, gently pressing into the fat pad. Stretch the penis forward firmly but not forcefully. Measure from base to tip. That's your flaccid stretched length. For girth, use a soft tape or string. Wrap around the thickest part of the shaft. Mark the overlap, then measure. Follow these steps, and you'll have an accurate, reliable number, not a guess based on stress, cold, or fantasy. Mistake number 2, obsessing over size, not function. Even if you know your measurements, many men get stuck on bigger is better. Biologically, the penis is a vascular organ, not a muscle. Size matters less than blood flow, nerve health, and tissue responsiveness. Emotionally, obsessing over centimeters creates anxiety, which can reduce confidence and performance. Practically, it shifts focus from connection, pleasure, and intimacy to a number on a scale. So what actually matters if not size? Mistake number 3, ignoring lifestyle factors that affect appearance and performance. Here's the truth. You can't change genetics, but you can optimize how your penis looks and functions. Tool number 1, reduce pubic fat. Excess abdominal fat can make the penis appear shorter because it hides in the fat pad. Losing just 2 inches off your waist can add 1 to 1.5 centimeters of visible length. Tool number 2, improve blood flow. Eat nitrate-rich foods like spinach, arugula, and beets. Consider supplements like L-citrulline or L-arginine under medical guidance. Stay hydrated, quit smoking, and do pelvic floor exercises. Yes, men need them too. Strong pelvic muscles improve rigidity, control, and responsiveness. Tool number 3, check your hormones. Testosterone fuels libido, mood, circulation, and tissue health. Low levels can reduce nighttime erections and tissue responsiveness. Start with natural steps: better sleep, heavy lifting, proper nutrition, less alcohol. If needed, explore medically supervised hormone therapy. Tool number 4, stop comparing, start connecting. Confidence, presence, and communication matter far more than raw measurements. Satisfaction comes from attention, sensitivity, and connection, not inches. Tool number 5, seek real guidance, not hype. If you consider enhancement, pause and ask, am I acting out of insecurity or lack of knowledge? Body dysmorphia is real, and surgery can have permanent risks without solving the underlying issue. Here's a simple science-backed action plan. Measure correctly using the flaccid stretched method. Focus on health, blood flow, and hormone balance, not fantasy numbers. Reduce pubic fat for visible improvement. Strengthen pelvic floor muscles and optimize cardiovascular health. Stop comparing yourself to edited, staged adult content. Connect with your partner or your body. Confidence matters more than centimeters. Seek professional guidance when needed, focusing on healing and optimization, not surgery. The majority of men are already within the normal range, right? And that's not a consolation prize. You are not a number. You are not defined by a ruler. Your performance, confidence, and relationships improve when you focus on health, presence, and self-respect. Imagine the freedom of letting go of comparison and focusing on what truly matters: connection, vitality, and satisfaction. That's power you can't measure in inches. So what's the real takeaway? Measure correctly, flaccid stretched length and girth. Focus on function, not fantasy. Blood flow, hormones, and confidence matter more than inches. Optimize lifestyle, diet, exercise, pelvic health, and hormone balance. Stop comparing, start connecting. Presence beats performance metrics. Seek guidance when needed, but don't fall for hype or unnecessary procedures. You might already have what you've been chasing all along. Normal is not average. It's healthy, functional, and more than enough. If this video helped, subscribe, hit the bell, and leave a comment with your questions. Share it with a friend. You never know who's silently worrying about the same thing. Remember, you were never too small. You were just never told the truth. Now you know, and you can finally focus on health, confidence, and connection. Take care of your body, respect it, and optimize it. That's real power. That's real masculinity. That's you in control.